So the project I led was called Becoming Poor, Experiences of and Attitudes to Poverty and Social Protection of the New Urban Poor in Bangladesh. And specifically, we worked in Dhaka and Chittagong. And we looked at experiences of people who fell into poverty following the COVID-19 pandemic and those who had not experienced poverty before. We also looked at their social protection experiences in that transition. And there were people who fell into poverty who were doing relatively well before, and since the pandemic have struggled to regain their livelihoods. And also we found that sometimes there is stigma or shame associated with accessing social protection support. And we also found that people that live in low-income neighborhoods generally have to deal with quite a lot of discrimination and stigmatization. When they go out and ask for official documentation, for example, or try to find a new job, and they tell people where they live, they find that they are being looked down upon and being treated in a negative way. So the first policy recommendation is to expand social protection in urban areas. Urban populations are underserved and largely unserved when it comes to social protection in helping them deal with shocks. But the pandemic has shown us that urban populations, and especially those in low-income neighborhoods, are really underserved when it comes to this kind of support, especially in relation to a shock that is particularly relevant for them. So they, in this case, lost their work and their livelihoods. The second one is that in the expansion of social protection, we need to make sure that whatever services we deliver is that they are delivered in a dignified and a respectful way.